The project that we've instituted here at Goulburn Hospital, it's looking at decreasing the opioid abuse and the opioid dependency in the post-operative patients.
Actually, the project started off with my idea of when I came across this concept that we need to reduce, it's an opiate endemic that is going around the world. So we started collecting the data, we got all the team involved, the multidisciplinary, the dietitian, physiotherapy, Alice from pharmacy, and the wonderful medical students.
We know that there's a problem in the community with opioid excess use. We know that it often starts after a surgical procedure. So it's benefit and harm that we're trying to balance.
So following the audit, we were able to put in place initiatives that were context specific to Goulburn-based hospital. The two that we chose to look at were discharge summary templates for the doctors that are completing the discharge summaries for patients before they go home from the surgical ward. And the second intervention that we focused on was improving JMO education.
We minimized the long-acting opiates that were being prescribed. We changed them and we capped off the number of days that the patient would be prescribed opiates for. And if they needed any further intervention, they should be going to the primary care provider, which is a GP.
The overall idea is safe prescribing for patients while achieving pain relief and allowing patients to go through rehab and recovery safely and comfortably.
Multidisciplinary care is such a key to improving our patient outcomes, so it's a real joy to actually have such a cohesive team here and that everyone's really on board with helping each other out.
This project couldn't have been done just by the surgeons. A really important part of the project is the anaesthetic department, but also the pharmacists, the physiotherapists, dietitians are all involved in providing best of outcomes to patients. The early data that we have from our group of patients shows that the use of opioids has decreased significantly.
Using all the people in the team, we get the very best outcome for our patients, which is really what we want.